An online depression screening tool specifically for South Africans is in the works. Wits University psychology researcher Tasneem Hassem has been awarded 100,000 rand to finally develop and release this tool to the public. It's taken her 4 years to create as part of her PhD studies. This project comes at a great time, especially as many suffer alone under the isolating conditions of lockdown. Hassem joins us live now to discuss her new tool. Tasneem, thanks so much for joining us, and congratulations to you on this bursary, or the money that you've been awarded to develop this tool. Tell us a little bit more about it.
So the tool, was developed, took 4 years to develop, and currently what it does, it assesses depression measuring 19 items that is online, easily accessible by the general public of South Africa. There's no fee to take the screening tool. So an individual would go online onto the website that it would be placed on, complete the 19 items that has been adapted for the South African context. It includes items that are specific to the South African context in terms of symptoms experienced in South Africa. So items like I've been feeling, not myself, I've been thinking too much, which we find unique to South Africa, as well as experiences of bodily pains, I have backaches, and that's what we find South Africans present with. So the tool encompasses those items. In addition, it's also written in a very simple English language for those individuals to understand that are multilingual in South Africa and not first language English speakers. Once the individual then takes the tool, goes through all the 19 items, they will then submit the score and they'll get immediate instant feedback. When they receive the feedback, it gauges their risk for depression. So they could either be low risk, medium risk, or high risk, and it would advise them what the next channels are for them to seek appropriate mental health care in order for them to get treated for depression symptoms. So this instant feedback that they get, they can download it, they can save it, they can email it to themselves or the practitioner, and it can be that first point of facilitating the conversation between the mental health practitioner or even the general practitioner or nurse in terms of seeking help for their depression symptoms.
When can we get access to this and how?
Okay, so the tool is available online. We are testing it and further revising it. It's available through www.mddsa.co.za. So it's currently being revised and tested. It's the beta version of the tool.
Wits says that in South Africa, access to mental health care facilities is limited to around 4 beds for every 100,000 of us in general hospitals and 16 beds for every 100,000 in mental health hospitals. In your experience, how prevalent is mental illness like depression in our country, and how will your initiative free up beds? I think it's getting the treatments that's such a big part of the problem.
So the first thing is, the bed space is when individuals then lead, to very severe form of depression and it's not treated or picked up earlier. So by doing the screening tool, they engage with the depression symptoms earlier and can seek earlier help and prevent them from ending up into the hospitals. And definitely, prevalence rate of depression is, we're looking at about, approximately 5 million individuals in South Africa would then have an episode of depression or be diagnosed with depression. So the facilities we currently have is very limited, including the amount of psychologists available to individuals in the public sector. We look at just approximately 1 psychologist per 100,000 individuals in South Africa in the public access that psychologists cater to.
Last question, Tasneem. What are some of the markers or presentations, if you like, of depression that should motivate one to go onto the app?
Okay, so it's a website and not an app. One of the things would be, individuals start feeling sad for a very long period of time, and they just can't shake this feeling, or the feeling just doesn't go away. Also, they find that they're struggling with daily life because of this. So their loss of interest in daily activities and, to carry out daily routines such as going to work or, running their households. This is what should prompt an individual to start seeking out, psychological services.
All right. Thank you so much, and congratulations to you. What a service you're giving to our country. Thank you so much. Wits University psychology researcher Tasneem Hassem. Thank you for your time this morning.